A very good evening to you. Thank you for keeping it here with us on UBC TV. My name is Sophie Matovu and you are watching U Health Chat. Now, let me read for you this. According to a report from United Nations Youth, today young people aged between the age bracket of 15 to 24 or 25 account for 40% of new adult HIV infections. Now, each day you'll find, or each week you're having about 500 new cases of HIV, and that brings the amount of people or young people living with HIV going very, very high. Our topic tonight is HIV prevention, but with a focus on the young people. In studio with me is Dr. Yunus Mia, who is the Director of Programs at TASO Uganda Limited, and he has got a wealth of 10 years experience. He has had several innovations in HIV prevention, treatment, and the quality of life. Doctor, a very good evening to you.
Good evening to you, Sophie, and good evening to all our viewers. Thank you very much for having me today to talk about health, but specifically HIV. I'm a very passionate person with discussing and responding to HIV, and thank you so much for having me.
Okay, now let's get to talk about TASO Uganda. You know, when we talk about just even TASO Uganda, some people feel like, does that organization still, is it still fully functional? So maybe take us a bit and the services that you have got to offer as TASO Uganda Limited.
Yes, thank you so much, Sophie. TASO Uganda is one of the oldest organizations in Uganda, started and owned by Ugandans, that initiated or led the response to HIV as early as 1987. So during that time, we didn't know much about HIV. So almost a lot that we have learned today and a lot that we do today was initiated by those who led the fight during that time. So from that period, maybe just to give you a bit of a highlight of TASO, when TASO started, it was more of a community response. People who were affected by HIV, and we give tribute to our founder, Dr. Noreen. We thank her so much for that work and her team that initiated this fight. They came up as volunteers to support those that were infected and affected when there was no systematic way to respond. And they pulled so many people together and came up and initiated a national response. So currently TASO is almost in every part of the country. We have 11 centers in different districts, and it's a membership organization where anyone can become a member of TASO. So perhaps by the end of the day I will have convinced you to become a member. And anyone can be a member. You don't have to be a patient or one who is infected. Anyone in Uganda has at least been affected in some way. And when you feel the need to support, then you come and join this fight. So how do you join? You become a member through subscription and then through participation. By participating, you make your commitment to end HIV and ensuring that you practice and do your best to ensure that those who have HIV do not spread it, and then those who don't have it practice or live in a way that they do not get HIV. So that is the only way we can end HIV in Uganda. And that commitment is for all individuals and persons that join TASO. And for the last 37 years, that's the message we have been passing across.
Wow.
The general public, everyone should be responsible to end HIV. And through the 11 centers, we now have a number of services, from advocacy to ensure that the topic of HIV is alive. Everyone is aware about how HIV is transmitted, how it is prevented, and how it is treated, and all that. So we work together with all age groups, all individuals, to ensure that everyone is aware. And my coming here today is a big privilege and opportunity to share not only what is available, what is known, but also recruit you and encourage you to come to join this fight even now. I know it is 37 years, almost 40 years of HIV, but the disease is still there. So we need to continue to come together to end this disease. Now, at the centers, just like many other facilities, we offer beyond advocacy and information giving, prevention. We have a number of services that are available for the general public, for specific groups, to try and intervene to prevent HIV among the different social groups. So we offer free condoms to everyone who needs them at different points, from the TASO centers to public places. We make sure we are refilling them. I'm sure when you go to some public toilets or some public busy places, you'll find those small boxes where condoms are put. So we ensure that we refill them for those that need them. We continue to discuss messages of prevention and faithfulness and abstinence. And then we also provide other methods. We call them biomedical prevention methods, because we are doing something to someone or to the community to prevent. So among those is we carry out circumcision for males, and for the last 15 or more years we have been encouraging males to get circumcised, because circumcision through science showed that men who are circumcised have a reduced chance of picking up HIV.
Yeah,
then we also provide some medication that is taken for prevention. We call that PEP and PrEP. Now, the difference between those two is that PEP, you take it as an emergency when you think you have been exposed to HIV by accident. Then PrEP, will take medication if you know you are at risk consistently. So then when you have these drugs, then they kind of are in your body when HIV comes in, or you get an accident. No, this time not an accident, you are exposed. When you actually are aware, then somehow the medicine is already there, so it prevents the virus from growing in your body, so you are protected when you're having these drugs. Then there are other ways in which other prevention services that we give, including behavior change. We want to talk a lot about the social, economic, dynamic factors that we all have in our everyday life that increase the risk of risk behavior, which eventually results into HIV acquisition. And I think today you've talked about the youth, and I know that we'll be speaking a little bit more about the youth. What are the youth factors? Why the youth? And why is it important that we prevent HIV among the youth? So we'll be delving that a little bit more into that. But beyond prevention, we also provide medication for those that are infected. Now, not only medication, those that get HIV can live a normal life expectancy if we actually are able to put them on treatment and do many other things for them that help them make the right choices of life. So the range of services that we provide for those that are positive are aimed at ensuring that they live a normal lifespan and get the best potential out of them. And that's possible these days. Whether you are born with HIV, whether you pick it up at any one particular point in time, you should be able to live your normal life expectancy if you follow our advice, if you follow the right procedures and processes that will help you to walk through this journey. So at TASO and many other sites in the country that provide treatment, you are actually able to live your life free of any ailments. You can have HIV and be a normal person. So because of that, I really like speaking about this with passion. Everyone should know their HIV status, because there is treatment. And this treatment can give you a normal life, and you shouldn't be worried about your work, about raising your children, about all these fears that we had in the beginning. So come out and test and ensure that you know your HIV status. That is the only way we will end HIV. So that's in a nutshell about TASO, and we continue to work and walk with all Ugandans to end HIV.
Okay, that's fantastic. Now I'd like to get to the area that you're passionate about. That is the young people. And you know, when I looked at these statistics, I was like, really? Is it for real? It really seems alarming.
Yes.
500 is a big number. So what are the statistics averagely in terms when it comes to the young people that you as TASO Uganda are managing of the young people?
Oh yes, HIV is here with us, and we need to know a little bit more about it in terms of numbers, and thanks for asking that. As a country, we have done a lot to try and reduce the number of people getting HIV every day, and we have been very successful in that. Back in the early days, we had about more than 10% of the population in the late 90s and early 2000s having HIV. Currently, we have about 5.2%. So we've done, as a concerted effort, a great job to deal with that. However, 5.2 is not a small number. So we still have a significant number of people having HIV, but the most worrisome part is that despite what we know and what we are doing, we are still having people getting infected. And it's quite confusing in a way, because we now seem to know everything. We know how it is transmitted, we know how we can get treatment, we know we can actually end it. But somehow new infections keep coming up, and that tickles our minds. What is the reason? What can we do? And when you ask about the numbers, how many people have HIV, how many people, especially among the youth, are getting infected, those become important for us to know. So we currently have about 1.4 million people in Uganda with HIV, and that is estimated, but it's close to that. And about 95% of those are already on treatment, and they know their HIV status. But we have this small group that does not know their status. It could be you, it could be me, it could be anyone. So if you have not tested and you are not interested in testing, but you know you're having a risky behavior, you could be actually the one that does not know about your status. So we need to close the gap and know that everyone who has HIV is tested. But remember, there are people picking up HIV almost every day. So that means that every time you are risking yourself, then you also need to test and then become aware. Now, because many people are on treatment, the rate of transmission goes down, and I'll explain later how that works. But what is interesting, or what is still challenging, is the fact that despite us having all these people on treatment, that small group that doesn't know is still growing. You keep, because today you think you have picked up everyone, I mean you're close, but we are still having a disturbing number of new people getting infected. Like you mentioned earlier, about 580 people are getting infected with HIV every week. And a big proportion of this is young women between 15 and 24 years. And the question you want to be asking yourself is why, and what are the reasons, and what can be done about this. So there are also other groups that we see being more at risk than others. We have seen, of course, we all know the risk that is involved with commercial sex work among women, and that group also has a high prevalence. Then there are other social groups we call key and priority populations, who, like the people involved in fishing, because of the environment around the landing sites, also have a high HIV prevalence. Then we have other groups, including those in prisons and incarcerated persons and so on. But today, because we want to talk about the youth and keep the topic to the youth, we want to ask ourselves, why the youth and why the young girls? So we all know from the communities that we live that our knowledge of HIV is there, but our knowledge of sexual education is kind of not very elaborate. We have challenges talking about sex and sexual education with our children. And in the end, our children end up having, or the youth and young people end up having unplanned, unprepared, unthought sex. And that becomes one of the biggest reasons that HIV easily gets picked. And when you look at when a person is aware of their sexual risk, and they have planned and thought about it, then they're likely to use protection more than when they're unaware. So the biggest problem among the youth is actually unplanned sex that is not protected, because it's unplanned, and then it is random and so on, with a lot of factors behind what leads to that kind of behavior. So in the end, we see that the young girls are not able to protect themselves as a result of so many social factors when they're having this unplanned or unthought through sex. We see that many of the young girls and also young boys fail to use protection, perhaps because of information and knowledge, access to these, and even when they have access to them, or perhaps the condoms are in some places, they are unable to ask for them or even buy them if they need to be bought. So they find themselves in a situation where they are just encountering sex without having the rightful protection. So if we increased our capacity to talk to them, to enlighten them, to prepare them, then we think that when they are making the sexual choices, then these choices will be right, either to abstain because they know the dangers, or if they actually make the choice to have the sex, then it should be protected. So now there are many factors, socio-economic, that drive this, the behavior to have sex at that age. For young girls, commonly we see that those that are not in school, and then those that are not well economically, get driven by these different factors to be in position to indulge in early sex, or early unprotected sex, or cross-generational sex, or some form of sex for transactions. So all these end up putting them at a risk that they wouldn't have if at all, if they were in a different situation. So for us to actually think about how to address HIV among the youth and the young girls, we must first of all become honest with the reality, appreciate some of the social dynamics that lead to vulnerability, and then be able to address those. So keeping young girls in school, ensuring that we take care of them as parents, talking to them, sexuality education, that is very important to support these young girls and also young boys to see that they have the right information, they have the right social protection, they have the right environment to make the decisions that they need to make. Otherwise, I will emphasize again, if we do not have that environment, then they continue to be at risk. And that risk continues to drive the numbers that we see out there of the new infections.
So Dr. Yunus, when you're dealing with some, I know you're now possibly out of the actual practice and you're more into intervention, policies and all that, but at the time when you were in it, of course, I don't think it was as alarming as it sounds right now. What are some of the worst case scenarios you have seen, and possibly what is trickling it that way? And why is it that it's more of the girls? Is it because they're more easily vulnerable? What exactly happens?
So yes, the issue with the girls is the fact that in our environment and in our culture, our social behavior, girls are raised to be a little bit more submissive, if I'm to say, and not have a proper or strength in bargaining and also self-protection. So in that environment, especially if we do not empower them early enough, you find that if they're in a situation where they must make a choice, that choice will not be in their advantage or in their interests. So and we need to reflect on our own environment, in our own homes and in our own households. How do we actually raise the girls to be more assertive? How do they be more empowered to make decisions and not be raised to think that it is other people to make decisions for them all the time? Because at that point when they must make that decision, all this experience comes in to kind of help them to make the right choice, because we are not there when they are making those choices, but the way we have built them is what will help them. So education for the young girls is one key strength that would help them to actually make a right choice, and staying in school is one other. Ensuring that they delay sex as much as possible by having other things they're doing rather than just be out of school and trying to fend for themselves at a young age. Yes, of course we also see that boys face the same, some of the boys face the same challenges, getting out of school early and having no information, but at a younger age we see that boys need the courage to reach out to girls or women, but the girls will be approached. So therefore we have to be in position to empower them as early as possible. And you can't ignore that, because you clearly see that the risk becomes higher for them to start sex early than for the boys. So if that is the true social environment, then what do we do to ensure that they are prepared for such encounters when they arise? Yes.
Now, as at TASO Uganda Limited, what are the strategies and interventions you're using to try to ensure that when these young girls and young boys come to you for counseling, you're preaching the message? Because certain times, famously, at the time when we were very successful, yes, even now, good work is being done, the ABC strategy was like a song.
Yes.
Is it still one of those that is still being used right now by some of you people, or you have some other new interventions you have put in place to ensure that there is prevention?
Yes, so
and safe sex.
Thank you. I think that's a very tickling question, because it comes back to us asking ourselves what is possible. Yes. So as a health institution, we have to evaluate what works, and there are things we have known that work. So first and foremost, we must consistently provide information, and the right information, in every forum and every opportunity that we get. So we have programs where we engage with young people. This is one of them where I'm actually giving in the time to come and talk about it. Perhaps one or two persons speak something. At our facilities, we have adolescent groups and adolescent youth-friendly corners where we deliberately invite youth, and they don't have to be HIV positive, those who attend these corners. It is youth to learn about sexuality, learn from their peers, discuss in a guided environment where we are available to answer questions and provide facts and share and demystify or deal with myths and so on. So we think, or we have always thought, that these continue to be a very great opportunity for young people to learn something new, and also learn how to deal with this difficult environment. Beyond information giving, we also train them in certain skills and living and certain behavior, in a way that we have programs that target young girls to learn about certain life skills and behavior patterns that help them to be protected. So we have a program called Dreams. The Dreams program was started in South Africa, was proven to be effective to empower young women with not only life skills, but behavior skills, communication, and so on. Now, we identify communities that are most vulnerable and at risk, and we pick up groups, or we identify groups of girls and enroll them onto these programs. And in these programs, we layer a number of services. Among those services are HIV information giving, HIV testing, life skills, including, especially for those that are out of school, we get them into a program where they speak to each other, learn a few skills, including life, like economic empowerment skills, maybe vocational training. We also are able to train them on assertiveness and how to protect themselves in case they are found in a situation where they need to exercise assertiveness. And these programs are in our communities. Currently, we are we are running them almost countrywide, and we recruit these girls that are mostly out of school, but there are also school programs which we identify girls that are vulnerable and then provide them with the necessary skills. Now, that is at behavior change. We also have opportunities to provide certain prevention measures for young women and young girls. Now, those we identify to be at risk through either their work or through their environment or through their relationships or every other social environment that they're interacting with, we enroll them on the programs I had mentioned of either PrEP or PEP, or actually provide condoms for them such that they are protected when they have to be protected. So these are freely available for young women that know that are at risk, because each and every person has their own risk environment that is different from another. So what we usually encourage is when you know yourself that you've been involved in a risk, then that risk is likely to happen again. So you talk to a counselor, come and talk to a health worker, and then you walk through a journey of how to protect yourself. Many times you don't even know where to go. You don't know how to deal with these situations that are happening to you. So we have services that will help you, will help young women and young men to evaluate themselves, but also evaluate their risk, and then decide on the choices that would be best for them based on what is available. So I would just speak to all the youth out there that do not suffer in silence, and just keep quiet when you have been abused or you are in a risky situation. There is something that can be done about it, especially in the context of HIV prevention. If you have had sex for the first time and you don't know the person you have had, you don't know the status of the person, you're scared, you don't know who to tell, you can come and talk to us, and then we will know exactly how to help you, and then also help you in the future to not be in the same situation again. So those services are there also for the young people.
Okay.
Yes.
Now there is a category of young people. It's not their making, it is not their doing. They have possibly even lost their parents. They were born HIV positive, and now they have grown up into young, beautiful women. How do you deal with those? Not even only the young women, they're also the young boys. How do you deal with that category of people as Tasso Uganda, of young people?
So you're right. We have lived with HIV in Uganda for more than 30 years.
Yes.
And there are those persons who were born with HIV and they have grown up with it.
Yes.
The only message before I say anything is that being born with HIV is not a crime.
True.
And you are actually able to live a normal life like any other child, because we have seen this. We have worked and supported young people live through their life, and they are living a happy life. They have work, they are living like anyone normal. So I don't even want to use the word anyone normal. I'm saying they are normal. And we need to treat them that way. We need to be able to appreciate it, that it is what it is. Now, growing up with HIV, of course, has its challenges. The person who is born with HIV must take their drugs for the rest of their lives, from the moment when they are born to the moment when they grow up and become old. So to live on taking drugs every day requires some commitment. And one of the things that we do is keep being the morale boosters and the supporters and the system they can rely on to keep that. Even when you pick up HIV as an adult, taking drugs for the rest of your life is difficult.
It's difficult.
So one of the challenging parts is always that, and we work with them to ensure that they live a normal, productive life on their treatment and ensure that they're on their treatment. Now, among the challenges of growing up definitely is feeling different and all that, and sometimes as they grow up, they are trying to identify themselves and asking many questions, as all adolescents do and all young people do. So we are there with them to try and be in position to provide the social and behavioral environment and support that they need to make the right choices. So one of the biggest emphases we commit ourselves with them is HIV prevention, because we are aware they'll become sexually active at some point. We are aware that they want to get married. We are aware that they want to have children. So sexuality education becomes very important, but also providing counseling in regards to adolescence and being a young person, and how do you live with HIV through your adolescence. So these young people are just like any other young people. And they're just young people, if I'm to use that word. So they will experience sexual urges, sexual needs, sexual relationships. And we think it shouldn't be any different. They shouldn't just have sex because of pressure or to feel normal. We tend to say, no, just have a normal life. You don't have to be pressured into any behavior that is not right for you, especially if you've made a commitment to not prevent HIV. So, and many of them have made choices to get married after they have become grown and ready, and that is a very important and interesting part of their lives, because then they're asking themselves, who do I marry? Am I free to marry anyone? Am I how? And our message is always very clear, to be in position to openly discuss that with their partner and disclose at the earliest opportunity, such that they make the right choices and the other person also makes the right choice to be with a partner that they want to be with. So in the process, we provide services for counseling. How do you actually identify, not how do you identify a partner, but how do you live with a partner that you have identified? And what is possible? How do you get children that don't have HIV and all that? And I would want to tell you that currently in Uganda we have managed to push a program forward that supports every HIV positive mother to have an HIV negative child. Yeah, true. It is actually a problem right now if you're an HIV positive mother and you give birth to an HIV positive child, because it is possible that you should have a negative baby. Yeah, very. And every resource is available for you to have a negative baby. So the only persons these days that we see having positive babies are those that have failed to come out, that have failed to receive their treatment or to actually receive help. So even these young people who grow up with HIV are capable of getting negative children. They're having normal families, and there is totally nothing to worry about for them as they get their children. So, but the important thing is that the relationships have a commitment to disclosure, and then we are able to make the right choices for them. I mean, they make the right choices for themselves, but with support.
Then how are you dealing with the issue of the stigma? Because, you know, now we're talking about the two who are in love.
Yes.
These are the two young people.
Yes.
One is positive, the other is negative.
Yes.
How are they able, they will come separately here and say it, but there are also others who we've known that will keep quiet about it for the years, and they'll continue with their partner, take their pills as they're taking cover somewhere. What are the causes of some of these situations? The stigma, because I know parents will reject.
Yes.
And especially if they're the parents of the child, where they realize that their child is negative, and they're like, this one wants to kill my child. Okay. There is still that stigma. how do they go about it, and how do they ensure that they stay safe?
Yes, that's a very important aspect, especially for the young people in that situation. And I'm glad you bring it up because it's a reality. It's not even a very far-fetched scenario. When two young people meet, and many times we encourage that you both go for testing for HIV, irrespective of whether you trust or know this person's HIV status or you don't. So it doesn't matter whether I am positive and you're negative. The first message we want to put across is that the first thing that comes to your mind before you start a sexual relationship is do an HIV test. So you shouldn't trust anyone out there to say, I think this one looks okay. No, I think an HIV test is important. And then for the young people that are HIV positive, many times, I mean, our encouragement to them is even before you get into a very deep relationship, you can disclose, and then a person makes a choice. But then sometimes the relationship is built, and then it is going on for a while. It's still our responsibility as individuals that you do not get into a sexual relationship without knowing the other person's HIV status. So I'll emphasize that. Now, with disclosure, and you both know the situation, we have series of discussions that we have. And among those discussions, I just want to provide some information, is that a negative person and a positive person can actually marry. And the focus is for each of you to remain the way you are. The HIV negative person should remain negative, and the positive person, of course, should stay on treatment and live a normal life. Now, we provide that information and the ways in which this happens. One of the clear messages I want to pass across today is that actually a person who is HIV positive and they're on their treatment cannot transmit HIV to an HIV negative person. So for as long as they're on their treatment and they are suppressed, they can't transmit HIV, and I want to just mention that because it is a fact. However, that person must stay suppressed. That means their drugs should keep working. You don't know when they stop working. So many times we encourage that persons that are in a discordant relationship, we call it a discordant relationship, use condoms too, because you do not know when the risk emerges in this other person. So using condoms is something we encourage, and we think that with that, when you are in a relationship that is trustworthy and you kind of are able to talk to each other, then that should be able to help you to live together. Then now, at the point of getting children, you want to get children. So you usually want to speak to us, to a counselor or to a health worker, how that works out. And I've spoken about these different measures that we have. If you are at risk of HIV, you can take PrEP. Or if you have gotten an accident, you can take PEP. That is available. So these discordant relationships, sometimes we're like, okay, if you're thinking you want to get pregnant or you want to have a child, then the negative partner can get onto PrEP for that period. And if this person is on their drugs suppressed and you're on PrEP, then it's very unlikely
that you will have a positive baby.
You will get HIV during that period. And then now, if the positive partner is the wife, then, or is the female, then she joins a program for prevention of mother-to-child transmission and will get a negative child. So we've seen that successfully happen, and we've gone through this successfully, and therefore it's very possible that it can happen. But many of the young people choose to get a positive partner, and somehow when they do, then all these other precautions and other issues perhaps don't have to come up, but then getting a negative child becomes a priority, and therefore precautions have to be there either way. So then what happens when all this breaks down. Like for instance, relationships start, we are not honest with each other, no one is disclosing, you don't want to test and all that, then you go back to being uninformed and taking the choices that are not right for you. However, I just want to mention also one thing, that one of the biggest challenges, especially to dealing with HIV in Uganda, has been stigma. And stigma is a big topic. We may not spend a lot of time talking about it today. I perhaps will just highlight a few things of why it is a problem. Stigma is where a person is pointed at or negatively for their specific problem or situation they are in. So if a person has HIV and you treat them differently in a negative way, that is stigmatizing them. Yeah, true. So when we stigmatize people, or even yourselves, it doesn't have to be HIV, then you don't get the right cooperation from the person that has the challenge. So in HIV, stigma has been a big problem, continues to be a problem, and when it is a problem, then all these things we are talking about seem to get distorted. Then the person who has HIV is not likely to disclose, or the person, because perhaps they're afraid what the parents will think, or they will want, or they will be ridiculed, or they will be all these kind of things that people do. What I encourage all of us as a community, or all of us as a country, is to acknowledge the fact that the only way we'll be able to end HIV is to be open about it. We need to treat each other right. We need to empathize with everyone, and then understand that no one makes a choice to be HIV positive. But because the problem is there, we need to find a way of dealing with it. And having an understanding posture and being able to appreciate what to do right helps the person on this side to also make the right choices for themselves, but also for us. So addressing stigma is very important, and many times we don't know when we are stigmatizing others. Talking about them behind their back, or being able to point at them and then discriminating them in some way. Now, like for instance, in such a scenario where two persons have decided they want to live with each other, and the parents are like, no, it will not severely putting up resistance. I mean, what message is going to happen to the person who has disclosed and all to the others that would wish to disclose? So it's a very interesting topic we could talk about much, much longer. But what I just want to emphasize about stigma is that you want to treat others the way you'd want to be treated. Exactly. So if you are the one who had HIV, how would you want others to see you, perceive you, but also help you live a normal life? And if you appreciate that, then you will be able to know that, yes, I have responsibility to make the right choices for myself, but I also have responsibility to be respectful and helpful to others that may be in a challenge.
Okay.
Yes.
So in just like about 2 minutes or 3, kindly, I'm made to understand you have a tassel run planned out. Can you utilize like 3 minutes to tell us about the tassel run?
Yes, thank you so much for bringing that up. I had actually skipped it in my mind. For the last 37 years, we have been talking and responding to HIV in very many different ways. Now, right now we are looking at how to make the message, the discussions fun, and we came up with the tassel run. And this run is to help us interact with each other and recreate awareness in a fun way. So TASO is organizing a run on the 11th of November in Kampala, but it's a national-wide run. This run will be in the different districts where we have TASO centers, so you don't have to be in Kampala to participate. You can actually join in your district and be able to join the run on that side. But in Kampala, we'll be in Makerere University, starting very early like all other runs. And we think that this will be a new platform for us to keep engaging. So each year we are going to be running, and we want to run until the end of HIV. I know we've committed ourselves to end HIV by 2030, so the drive is on, and I invite all of you to come and join this run. You join the drive to create awareness. You make your commitment as an individual once again to see that you play your part in the participation to end HIV. And when we do that, we think that we can meet the target of ending HIV by 2030.
Okay, that's a very, very good one. Doctor, I can't take it lightly. I do really appreciate your time. And also as a UBC, send regards to the founder member. We know she's very, very busy. But for having a team of people like you who can be able to communicate to the different young people who come to the centers for the support that they require, and also for enriching us with this wealth of knowledge and information. Well, that is all we had for you tonight. That is from me and Dr. Yunus Mia. And I would like to say that young people, you are at the center of this. And yes, we have the peers and all those that support us as we grow up, but also the parents, you have a role to play. Please do not push away these young people. Do not shy away to talk to them about sex education, because the minute you do, they are going to go and discover and get this information their own way, and they'll possibly get it the wrong way. There is still a lot more to talk about in line with this topic, and possibly when we get the time in one of the shows, we shall still come up to share more details about it. That is all we had for you tonight. It's good night from me and Doctor, and it's just a few minutes to the top of the hour. Rod and Gonzi will be coming with the 10 o'clock news. Good night.